about it. Tell me all about it. I'm here. I wanna know what's on your mind. Ooh, the world needs to hear from you, and I'm so glad to have a conversation to reach the nation. And it's all about you. We'll help each other to discover innovative ways to positively change the world. Let's talk about, let's talk about, yeah, let's talk about conversations with Nicole.
Greetings. Happy Monday. Welcome to Conversations with Nicole. I am Nicole Everett, your host, and Conversations with Nicole is a talk show based in Tallahassee, Florida, focused on connecting the community through conversations. And today is what I call Mindset Monday, which is an opportunity for you, me, and my guests to talk about whatever it is we want to talk about. And today I have not one, but two very special guests. The 2024 Tallahassee AIDS Walk is taking place very, very soon. And so my guests are intricately involved in that walk, and I'm going to bring them on shortly. But before I do, I need to hear from you. Where are you tuning in from? We are live on Facebook, on YouTube, and on my personal LinkedIn page. So tag a friend and let them know they need to be on here. If you will, in the comments, put your city and state so we can give you a shout out. This is an interactive live. This is a safe space for us to engage and communicate with one another. So we fully expect to receive your questions, your comments tonight. So again, walking to end the HIV/AIDS epidemic is our topic. Walking to end the HIV/AIDS epidemic is our topic. And I see my mom is on down in Miami. Thank you for being here, Mom. My mom is my number one fan. I'm telling y'all. I love it. All right. So our special guests are Joseph Ward and Serene Smallwood. I'm going to go ahead and share their bio. So Serene Smallwood is the community volunteer and events coordinator at Big Ben Cares, managing the agency's public-facing presence in the community from volunteer direction and social media to large-scale fundraiser event planning. Serene ensures that the mission of Big Ben Cares gets exposed to the broader population of the 8 counties it serves so that as many as possible in the Big Bend area know how to engage with the ongoing efforts to fight HIV/AIDS locally. She graduated from Florida State University, Go Noles, with a Bachelor of Science in Criminology and a minor in Biological Sciences, finding her passion for leadership and event planning through her leadership roles in student organizations. Y'all help me welcome Serene Smallwood.
Yeah. Hi, hello, good evening.
Good evening. Welcome.
Yes, thank you for having me on.
My pleasure. So, Serene, one of the things that I ask my guests is, who are you? Not what you do, because I just talked a little bit about what you do, but who is Serene Smallwood in your own words?
Well, definitely, I would say all of it comes from being a huge nerd. I'm definitely into the pop culture sphere, so anime, gaming, all that stuff, millennial zone. But I say that like the work that I do right now in event planning is only because of like my passion for that, because I was actually president of the anime club in college, and I was running the anime convention on campus, and that got my event planning experience hosting one of those big scale like nerd events. But that's the reason I have the position that I have now, because it got me into that skill set, I guess you would say. But now I'm still a nerd, even though I'm helping with the philanthropic goals of Big Bang Cares. I still go to conventions and do all that. And I love playing video games and, like I said, just watching show and movies and all of that.
Wonderful. Well, in a little bit, I want you to share with our viewers a little bit about Big Ben Cares and what Big Ben Cares does. All right. All right, I'm going to introduce Mr. Ward now. So, for those of you who don't know Joseph Ward, y'all have not been out in these streets. Listen, Joseph Ward is a Florida A&M University graduate, go Rattlers, with a bachelor's degree in psychology. Mr. Ward has over 10 years of experience in delivering academic success presentations to grades K through 12, college and middle age adults. Sorry about that. By working in such diverse venues as grade schools, college campuses, juvenile divergent programs, correctional institutions, religious communities, homeless shelters, and foster homes. Mr. Ward has gained the experience of providing valuable life skills training to various community members, and he is a past CWN guest season 5 for On the Shoulders of Giants. Y'all help me welcome Joseph Ward.
Hello, hello, hello. How you doing? How's
Do-
everybody doing?
Doing good. Welcome, welcome, Joe. So, Joe, I got to ask that question. Who is Joseph Ward? Not what you do, because
Right.
look, that bio just gave us a snippet. who, who is Joseph Ward in your own words?
So I'm a Tallahassee native who has a heart for making my community better. I'm a Dallas Cowboys fan, a FAMU lover. Um, I'm a nerd as well. I'm a history buff. On the Shoulders of Giants is my baby. It's my passion. It's my YouTube channel. I'm an author. I'm a speaker. I'm a host. I just try to dip my hands into as many different things as possible within my community that I'm also interested in, because I learned to wrap my interest around my passions. And so that helps me go out and have fun and try to make my community better at the same time.
Indeed. And and I mentioned Joe being out in these streets. Any health fair in town, you will see him pulling up with the
Yep.
neighborhood medical bus, or not even with the bus. Listen, he don't even need the mobile. He'll just come,
Right.
set up a table, and give you the information. So we appreciate your commitment to the community, and just being out here feeding the people as well. Look,
Right.
he's at the food distributions and everything. So we
Nah,
appreciate.
I appreciate you.
Absolutely. So tell us about this event coming up.
Okay, this 34th annual Tallahassee AIDS Walk. It's a great event.
34th.
Yep,
My
yep.
goodness.
Yeah,
Okay.
it's been around for a while. So I know we got involved, neighborhood, we got involved with the AIDS Walk. I believe around 2018, 2019.
Mhm.
The AIDS Walk overall is well, I'm let Serene talk about the AIDS Walk. Get the details about the AIDS Walk.
Yeah, so AIDS Walk is one of the 3 major events that we run as Big Bang Cares, but it's the one that we do in partnership with Bond Community Health Center, Neighborhood Medical Center, and it is a overall celebration. It is an overall, remembrance. It is an awareness event / fundraiser. The AIDS Walk is an institution that has existed around our country for decades since the AIDS crisis. And this is so AIDS Walk, you may have heard that term in other parts of the country. We didn't invent it, but it's been around forever. And we got ours own right here at home. And that's basically, we invite everyone in the community that wants to come and stand tall with us and celebrate those who live another day. Every day with HIV is a victory, we like to say. So that's really the mean of it, because nowadays, right, we talk about HIV being kind of not a death sentence anymore, which is awesome. And I think that in addition to how we, memorialize those who may have passed, it's still important to know that AIDS Walk now gets to be contextualized as a celebration of also the living that happens. So we kind of make it a little party. In addition to the ceremonial walk around the laps at the nature trail, we will end up in a sort of block party, like a lot that we have reserved, where we're going to have music, food, gathering, and it's going to be a whole hoop-de-doo. So
Nice. All right, very good. So give us some details in terms of date, time, that sort of thing.
September 12th, Southwood Nature Trail, starting at 6:30 p.m. I think we have about 200 people signed up now.
Wow.
We have room for about 800 more, so everybody come on out. But like I said, September 12th, 6:30 p.m., Southwood Nature Trail. As Serene said, when the people get there, we will have a remembrance of those who may have had HIV and passed away for various means. But we're going to remember those whose shoulders that we stand on. We're going to have a little music playing, DJ Big Boy Swag, Ian, our IT guy, so shout out to him.
Okay.
Then we're going to get to the actual walk. So we're going to usher people down to the lake, actually have the walk and come back up. We have a special presentation from one of our community pillars in his honor and his name. So I don't want to fully give it away now, but we have something special for the community. Then and from there, we're going to party out. So we have a lot of different organizations that work within HIV/AIDS prevention or within public health or community health or human services. We have TPD coming out, Texas Roadhouse, Walmart, Gilead Sciences, a lot of different organizations within the city, because we're showing that even though we work in the realm of HIV/AIDS, the community partnerships is what helps us be successful in carrying out our missions.
Nice. And so today is the last day for pre-registration for the event, correct?
Yes, that's right. So Thursday is the walk. Today is Monday, and we have it set that the registration, online pre-registration, will be closing tonight at midnight. So that is not your last chance. We do have in-person registration available at the walk, but just for the sake of not waiting in the line and getting all your waiver and everything filled out ahead of time and stuff, that's going to be tonight by midnight. So right now, or when we're finished tonight and you want to do it.
Nice. All right. Very good. So that information is scrolling across the bottom of the screen for those who want to participate and take part in the walk. So we'll talk a little bit more about that later, but I wanted to get it out, out of the gate, just in case folks aren't able to fully join us for the entire broadcast. All right, so let's get started. I think probably I want Serene to talk particularly about Big Ben Cares, just who that organization is and what it does.
All right, so I don't want to go how far back we want to go, but Big Ben Cares used to be the known as TAS, and that was like Tallahassee AIDS Support Services, and that was like back in late 80s, early 90s. That was like the AIDS crisis, big and swing. Volunteer, like nonprofit, and then got incorporated and whatever, and then became Big Ben Cares. That was our acronym. CARES it used to be an acronym. It was like comprehensive AIDS resource education services. And then now we're Big Ben Cares, just full out. And Big Ben Cares is the Area 2B AIDS service organization. Area 2B means the 8 counties in the immediate area that we're in, the Big Bend. So that's Jefferson, Madison, Taylor, Wakulla, Liberty, Leon, Jefferson, like this whole zone. And so what that means, Area 2B, and we're the only one, is that we are the only organization providing comprehensive case management services and everything in that whole sphere. So if you're in any of those 8 counties and you get diagnosed with HIV, you're going to be coming to us. And that's just it. And we provide the service range from intake all the way through to, long-term care. And that includes housing, transportation, food, healthcare. That includes mental health services. And it could be another litany of things, home visits and stuff like that. So we kind of cover a comprehensive spectrum because, of course, HIV is a comprehensive illness. It doesn't just affect your health, but it affects your ability to seek opportunities, to get yourself ahead when it comes to jobs and living, to secure housing. And we serve most of our population that we serve is 200% below the poverty line. This includes people that are housing insecure and folk that may be incarcerated, as well as vulnerable populations like LGBTQ+ and Black, Hispanic, Native American, Asian, different folk that we see, or transgender populations, etc. So it is a whole network there, and we have 850 to 900 clients on my last look at it. So of
Okay.
folks across that.
All right. Well, thank you for that overview. I do want to acknowledge a few more folks that have joined us. Dr. Edwardo Williams, thank you for being here. Miss Tracy Gole, thank you for joining us. Sheila Morris is also here. Thank you for being here. Miss Tanisha, all of those people I just named are here in Tallahassee. And Patrick Irvine. Do you know Patrick Irvine?
Yep, podcast partner.
Uh-huh. All right. Thank you for being here, Pat. We appreciate it. So again, our talk is walking to end the HIV/AIDS epidemic. And so I thought a good place for us to start now that we know a little bit more about Big Ben Cares is, what is HIV?
Okay. HIV is a retrovirus that attacks a person's white blood cells, and the HIV virus in itself is trying to survive. So think about a virus that it's a bloodborne pathogen. So it's going to be found in blood products. So blood products are, of course, blood, uh, breast milk, semen, and vaginal fluids. Those are the four main bloodborne products or fluids, human fluids, that HIV would be found in. The fifth one that we would come across would be amniotic fluid, but a bloodborne pathogen that is trying to survive. So think about HIV. This virus is trying to survive, and it needs human cell replication to survive. So it attacks the CD4, the white cells, the white blood cells, the T helper cells. It's going to attack those cells. It's actually going to attach itself to the cells. Our white blood cells have receptors that are called CCR5 receptors. And with those receptors, HIV is able to attach itself to the white blood cell. After it attaches itself to the white blood cell, it embeds itself in the white blood cell. And there's a life cycle of the HIV cell. Once it embeds itself into the white blood cell, that cycle is about 7 steps. So basically, in a nutshell, it uses a process, they call it reverse transcriptase. Basically, what HIV is doing is rewriting the genetic code of that white blood cell. Once it rewrites the genetic code of the white blood cell, that white blood cell is now an HIV cell, is hosting the HIV virus within that cell. And the HIV virus buds out of that cell, finds another white blood cell, and continues that process. And so, once again, it's trying to survive, it's trying to stay alive, and it's going to exist in the host as long as possible, unless a person gets treatment or the end. So that's, in a nutshell, that's what HIV is and how it works. It's a retrovirus because it has the process of rewriting the code and replicating itself. It's also classified as a lentivirus, which is a slow acting virus. So that's why a person may contract HIV today, but it can be a 10-year period before that person reaches the classification of AIDS. And just to make it clear, HIV and AIDS are not the same thing. They're not interchangeable. HIV is the virus, AIDS is the disease. So AIDS will come about once a person has reached a certain classification or certain threshold as far as the HIV virus in their body. So the CDC has 2 definitions for what AIDS is. That is a person who has a positive HIV diagnosis, as well as opportunistic infections. And so just think of an opportunistic infection as any infection that could be in a person's body that is laying dormant in that person's body. One could be, an example is Kaposi sarcoma, which is a form of cancer.
That's a mouthful.
Yeah, it is. It is. And then there is also the thrush of the tongue, the oral thrush that can happen, as well as what they call AIDS-related herpes. The extreme of that will be the wasting syndrome. So another definition is if they pull 200 microliters of blood from a person and the white blood cell count is below 200, so anything below 200 per microliter, that will be classified as AIDS as well. So If a person contracts HIV and doesn't get the care that they need, that could push them into the AIDS classification. So AIDS is the progression of HIV in a person's body.
Wow. Okay. That's pretty comprehensive, but you broke it down well. Didn't know all of those uh ways that in terms of what did you call them? You mentioned blood, breast milk, semen,
Yes, and vaginal fluids.
and vaginal fluids. What do you
Hmm.
call those again?
Those are the blood-borne products or the body fluids that are a blood product, I would say.
Okay, gotcha. All right. So I didn't know those all were the body fluids that it can be transmitted through. And
Yes.
then the HIV, uh, you said HIV and opportunities.
Opportunistic infections can happen to a person who is in the AIDS classification.
Gotcha. Okay. All right. Very interesting. So, and y'all viewers, y'all chime right on in here again if you have some questions or comments. So my next question is, uh, who would you all consider to be the vulnerable populations for contracting the virus?
You want to take this one? I take it.
I mean, so partner answer there
Okay.
for us on our end. Vulnerable populations are going to be the sort of just a mirror of the vulnerable populations we see across most realms of what you would assume as a layman, right? Socioeconomic status stuff. So it's going to be, of course, people that don't have good access to health care to meet their needs. So it's going to be folk that are low socioeconomic status, meaning that they are poor and they are likely to be not have access to education, post-secondary. They may be folk that may be illiterate. Unfortunately, where the system has failed to close those gaps for education. And demographically, we see majority of clients are going to fall under the African American, the Black label, or with Hispanic and to other degrees. Then, of course, LGBTQ. That is still something that we have to wrestle with, of course, as one of those clinical gaps that we always find with the demographics for queer folk. And that's, of course, the history. The history of AIDS is, tied to it being known as GRID, and that was we're getting out of that now. And the demographics do change. We also, fun fact, have seen the rates of infection, or I guess diagnosis, for heterosexual individuals actually rise to meet that of the I guess the MSM or otherwise queer community. So those demographics shift as well. Did you have something? And then Joseph, if you had to add on that.
Yeah, just to add a bit to that, if you want to get a little more specific, so Black males, what we call MSM, men who have sex with men, but the LGBTQ population of Black males, unfortunately, they're still the group with the highest numbers. Now, with that's the numbers nationally and locally. So. Black males who have sex with other Black males, they have the highest numbers. Now, locally, we see a rise in Hispanic males who are LGBTQ, but we also have seen a rise in heterosexual Black women and heterosexual Hispanic women.
Okay.
And so those are a lot of our vulnerable populations. Age range wise, nationally, it is 13 to 24. They are vulnerable as far as HIV and STDs across the board,
Gotcha.
as well as 50 plus. Now, people leave out the 50 plus group. They're always looking at the young people, but 50 plus group is the second highest vulnerable population as far as age range. Locally, it is, I believe, 19 to 29 or 20 to 29. We still have our teen population, and then we have our 50 plus population who are still like the highest groups. And so those are some of the vulnerable populations that we will see. And if you want a greater scope of us locally, the 32304 area code, people who exist in that area code, maybe 32301 and 32310, those are the local area codes with some of the populations that we would consider our vulnerable populations.
Okay, now that is again very helpful. I don't see any questions, but I know you all are thinking because listen, my wheels are turning as it relates to this topic. I see a few folks that have joined us. Sharice, who is in Atlanta, happy Monday. Thank you for being here. And Lady Ward, good evening. She is here in Tallahassee. We appreciate you being here, Lady Ward, and tuning in with us. So, wow, I actually wrote down all of those populations that you all mentioned. So, lack of access to healthcare, education, poverty, African American and Hispanic, LGBTQ, MSM, men who have sex with men, heterosexual, Black women, and was it Hispanic?
Yep.
Okay. And Hispanic ages 13 to 24.
Yep.
And then the second highest was 50 plus. So I'm gonna pull the viewers in. Did y'all know all of this in terms of the populations? Let me know in the comments because I certainly didn't. Did you all were you all aware of those vulnerable populations? Let us know in the comments. Again, if you weren't, it's it's you fine. It's fine. You're not alone because I wasn't either. But let us know. Let us know. So, all right, we talked about vulnerable populations, and I'm curious now. If you do have HIV and have the virus and then get the disease, what is the care process or what's the treatment?
So like as Serene stated earlier, so if we we're out testing or somebody comes into our clinic or any one of our locations and they test positive, so the first thing we would do is we have a test and treat program with the health department. So the
Okay.
first thing we're going to do is immediately get them on medicines.
Okay.
What we've seen from our studies is if we can get them on medicines immediately within the first 3 months, we can get the person to what's called undetectable, which means there are not enough copies of the HIV virus in their body for them to transmit to another person. So,
You.
yep. So you're going to immediately get them on the medicines, but we're also going to enroll them into care.
Okay.
So with neighborhood, they're going to meet with our case manager. And when they meet with our case manager, we're going to sit down and we have a full assessment for them. And we're going to go through that whole assessment to get as much information as possible, going through a mental health assessment, all of their vital information, sexual history, all of that information so we can input that into the system. Then we're going to make sure that we link them to Big Ben Cares.
Okay.
If they have insurance, that helps. If they don't have insurance, it's okay. That's why we're sending them to Big Ben Cares. One of the programs that is within the care is our ADAP program or our AIDS Drug Assistance Program. This is going to allow them to be able to afford the medicines. The medicines are very expensive.
Mhm.
So the ADAP program will assist those who need the assistance to be able to get the medicines that they have. We're going to also make sure that we connect them with our providers. So, and I don't want to go forward without mentioning this. Bond Community Health Center is a part of this AIDS walk as well, and Bond Community Health Center is a part of the care process. So they are one of the healthcare facilities that a person can go to. But we're going to make sure we get them into care, get them with one of our providers, and getting them appointments, whether it's primary care or related to HIV care.
Okay.
Once they're in care, every 3 to 6 months, they need to get labs done. They're getting labs done because they have to come and see their provider every 3 to 6 months. This is to get an update on the virus in their body, how the virus is either progressing in their body, or if they're actually taking their medicines, they've been adherent, and they're able to suppress the virus as much as possible within their body. So that's every 3 to 6 months we're going to do that, and we're going to continue that process. And so our case managers are going to be some of the main people that stay in contact with the patients. And there's also linkage specialists. That's another one of my positions is a linkage specialist. So if people fall out of care, my job is to go find them. And then the health department also has disease intervention specialists who they assist in going out to be able to locate any patients who may have fallen out of care. So that's why we all have to work together. And we have to work with Bond. We have to work with Being Cares. We have to work with Malca, Boston Cares, the health department, FAMU, FSU. We're family and we work together to make sure our people get the care they need. But that's, in a nutshell, the care process.
I love to hear that, that all of these entities and organizations are working together to make sure that the folks here in Tallahassee get what they need to be well. We are about halfway through our talk. Time is flying right on by.
Right.
We have lots of comments that I definitely want to make sure we address. But for those of you who may be just tuning in, I'm on with Joseph Ward and Serene Smallwood. They are part of the, what'd you say, 36 years?
34th.
34th annual Tallahassee AIDS Walk, which is taking place this Thursday at Southwood at 6:30 p.m. Tonight is the last time by midnight for you to pre-register, and we'll give you that information about the walk later on. But you can definitely participate, and the proceeds go to assist the organizations that have been mentioned here tonight to do this very important work. So I see Patrick, he said that he did not know about any of this stuff before learning it from Joseph a few years ago. Thank you for sharing it. We got Donald Thomas on. He said Boyd Graves was on Trinidad Radio 20 years ago talking about U.S. Patent 5647773. Not sure what that is, but he also mentioned that this patent is owned by somebody named Robert Gallo.
Yeah.
Are y'all
Gallo.
okay?
Yeah, I'm familiar with Robert Gallo. I'm not an expert on Robert Gallo, but he is deemed as a person who is said to have the patent for the virus. There's a lot of different information out there, so I have to go a little further into that. I just know the surface of it.
Okay, that's cool. Thank you for sharing, Donald. All right, and Miss Ward, she said, well, I put a comment up, or she said, yes, I'm aware, and it's very, very expensive. All right. Miss Lisa Myrick on with us. Thank you for being here. And Denise J, she said, this may have been mentioned prior to me joining. What T cell count allows a person with HIV to be considered undetected? Does undetected reflect a person with HIV as well as AIDS, or just HIV? That's a great question.
I believe the undetectable is around 20 or 30 HIV cells within their body. I think it's around that area. I might be a bit off, but I think it's around that area. But the second part of a question, the undetectable goes for more so a person that is in the HIV state and not the AIDS state.
Okay. Good question, Denise. Thank you. And Miss Constance has joined us. Thank you for being here, Tina. All right. So, talked about the care. How do you get tested? Like, where do you go, I guess, to get tested?
Oh man, that's in Leon County.
In Leon County, yes.
You could throw a rock and get tested in Leon County.
Oh my goodness.
Wow.
Is that prevalent, huh?
We're very good about that, I will say. As far as the net that's cast, we have a lot of nodes of individual points where anyone can point you anywhere, and you can't walk more than 200 meters in a line and hit somewhere.
Right.
Okay.
Right. So, as I stated earlier, Being Cares provides free rapid testing as well as neighborhood medical center, Bond Community Health Center. You can get free rapid testing on FAMU campus, FSU campus, from Boston Cares, from IMG. You can get tested at Mosaic on Tennessee Street. So organizational Tennessee Street, you can get tested. And a number of these organizations have mobile units or do mobile testing. So we go out into the community. So it's not just coming to us, but you can go out to your community. But in addition to that, you can go to your primary care provider and request an HIV test. I did that myself. I went to my primary care provider and I requested an HIV test that sent you to either Quest or LabCorp. But that does cost, and that comes with insurance. And if you don't have those, that's why Bond Community Health Center exists and Neighborhood Medical Center exists, because we care for people without insurance. But we also have our free rapid testing. The Leon County Health Department has rapid testing available as well. So right now, Yashika D'Angelo with the Leon County Health Department is doing a great job of training future testers. What is our 500 501? It's a training for those who want to do HIV testing. And so with that, we are cranking out new testers all the time. But once again, community events, you can get tested. You can go to either testing location. You can call us. We'll come to you. I know neighborhood, we're on FAMU campus every other Wednesday, doing testing in the CAS building. We're on the set every Friday doing testing.
Okay.
Big Ben Cares has different locations that they go throughout the city. Bond have different locations that go throughout the city. And it's like I say, it's pretty easy to get tested, and free testing in this city, just knowing the organizations that test, or being at an event where testing is available, or just picking up a phone, calling, or emailing us, and we'll make it happen.
Yeah, no, that's very good to know. Very, very good to know. So my next question is around what the local HIV stats are.
Okay. So a good place to find local HIV statistics is Florida Charts. So I have some pulled up. So as far as AIDS diagnosis in the state of Florida, well, in the Leon County area, let me get my screen together and get it to Leon County. Here we go.
All right. And I see your question, Lady Ward. I'll get to it in just a moment.
This thing is, it would take its time now, but
It's
I think,
okay. Go ahead. It's fine.
I
Take
think from what I do remember looking at it earlier, our statistics are not as it's not there. There are not as many HIV cases as people think. So from my understanding, I think there's around 1,394 or 1,367 cases of people living with HIV in Leon County right now. And we have a population of around 300,000.
All right. But that's reported.
Right. Okay. So hold on, let me try this thing.
So while you pulling it up, Denise had a comment. She said, no HIV status positive should not be an indictment on living. I think she meant know that HIV status positive should not be an indictment on living a healthy life. A friend was forthright with her now husband. She is in excellent health and the HIV status undetected for years. Yes. Thank you for sharing that. All right. And we got Professor Carl Tone Jones says, keep pushing those facts, Joe. So
appreciate it.
So you on.
I have here. So in 2020, because our stats was they up to 2022. So in 2022, we had 76 HIV new diagnoses in Leon County.
Okay.
And that is actually an increase from 2021. But we kind of expected that. We kind of expected 2, 3, maybe even 5 years coming out of COVID that we may see higher numbers because of what was happening with COVID as far as everybody being cooped up. So 2021, we had 48 HIV diagnoses in Leon County, and in 2022, we had 76.
Okay, got it. All right. So I just wanted you all to be aware of those numbers. So do you know kind of where Leon County compares to other counties throughout the state of Florida?
We are, because this particular stat sheet doesn't show that, but from my memory, we're in the top 20 top 20 cities in the state of Florida as far as HIV diagnosis. It's a percentage thing too, and people have to look at that as far as rates. We're nowhere near the other cities or other areas as far as numbers,
Mm-hmm.
but as far as the rates or percentages, our rates they put us in about the top 15 to top 20 cities in the state of Florida as far as HIV cases.
Yeah, like Miami-Dade's like over 1,000.
Right.
It's different, a little different.
I
Right.
would imagine that to be the case. Yes. All right. So let me get back to Lady Ward's question, which is what are the steps in place in Leon County for prevention of contracting HIV?
So that is where our comprehensive outreach and education and prevention programs from all of the agencies at one come into play. So prevention is key. That is something that we preach. So prevention comes in the form of make sure people have information, access to information, and
Yep.
access to resources.
Mhm.
Case managers are very important. They are some of the most important pieces of this puzzle. A case manager is going to be the person who helps those who are positive or even people who are negative, help them find the resources that they need, but also our outreach workers. So that's why when we train outreach workers, we try to train them in the mode of a case manager, in the mindset of a case manager, of a social worker. Go get the resources, make yourself a resources, because the more information I have, the more access to information, more access to resources, this will help people be able to prevent themselves. If I can give as much prevention information and as much safe sex information as possible, if I can give that information, especially if I give it to them in the way that people can use it and use that information immediately, that will help them empower themselves, because that's the word we use, to empower themselves. As much information, as much resources as we can give them, we're going to inundate them with that and encourage them to use the information and use the resources, but also doing our best to incorporate behavioral modification. When we test people, we have a form, what we call a 1628 form, which is our risk assessment form. We're using that form to ask direct, specific questions to see if there are any behaviors that we need to help them modify. And we create a plan around them that works for them to help them modify behavior, because we're the experts on HIV, but they're the experts on themselves. So we're merging everything together to give them the best plan possible to keep themselves safe on the front end.
Gotcha. Love that. Thank you for sharing that. All right. I see Sheikah has joined us. Thank you for being here, Sheikah. She says, I'm diabetic and a person living with HIV who is taking their meds and keeping healthy can live much longer than myself. Okay. So she's saying that even though she's diabetic, a person living with HIV who's taking their meds and keeping healthy can outlive her.
Yes. And
Yeah. Yeah. So it's not a death sentence, right?
right.
Probably when it first came on the scene, and I recall, I'm probably telling my age, when Magic Johnson first kind of talked about it. I mean, there were so many unknowns. They talked about AIDS coming from Africa and all sorts of things. So, and we saw, right, folks getting sick and leaving here, right, and transitioning. And so I talked with you, Joe, prior to this broadcast about some of the days that celebrate um, or bring awareness to the virus and to the disease. But you mentioned, and I saw in my research, that there's a day for those who have survived it, like, and people celebrate that. So this will be part of, I guess, the walk as well, right?
Yes. We are going to do a remembrance for those who had untimely transitions, who not necessarily because of HIV, but people who had HIV and they had a transition. So we're going to celebrate their lives and the struggles that they've gone through, the triumphs that they've had, and the path that they cleared for us, because we love what we do, but we also understand that without those people, we wouldn't be here, because those are the people who advocated for us to be able to get the funding and the resources to be able to serve our community. So we have to honor those people.
Indeed, indeed. So let's talk a little bit about the local support. I mean, you've mentioned it a couple times, but I just want folks to be clear, and particularly in Tallahassee, you know, what support looks like. And it's not just the care in terms of medicine, but there are some other supports that are available, correct?
Yes. Now, Big Ben, once again, Big Ben Cares has a bulk of the resources and support resources. So I'll let Serene go into that. But I will say there are support groups, there are families, there are organizations, there are communities. When I got into HIV/AIDS, I really didn't know the amount of support that was out there. If a person is positive, what we can do, if they are ready, we can connect them with different people within the community, different support groups within the community who can help them in various different ways, whatever the need is. And those groups exist in abundance in Tallahassee. And if you don't know, well, if you're not within the communities, then you really don't know about them. That's why we try to scream to the mountaintop about them as much as possible. But start with the agencies. Start with the agencies who are working in HIV care. Start with the individuals, myself, Serene, Sheikah, Matthias Sweet, Darnell Durden, all the different people, Mr. James Easton, different people who work in HIV/AIDS at the different organizations, Miss Sylvia Hubbard and Nia Hubbard at MACA. Make sure you're getting with those people, because we have the resources. We can point you in the right direction to all the support groups and all the resources. But I'll let Serene talk about some more of the resources that Big Ben Cares has.
Okay.
Yeah, so I mean, resources are out there. The cost of everything continues to go up. We experience inflation. That is something that affects every household. And so I think it's really important to recognize and show our gratitude towards those as well in our fields and our agencies that are doing like grant writing, those kinds of things, which is basically the way by which we can, as agencies, make requests to like state and federal government levels in order to acquire more funding, in order to distribute those resources where they got to go. And all of that is an interwoven network. So that becomes, you know, the end result. If there is any sort of shortage where, you know, government policy and things can change stuff around, budgets change, and we have to be very flexible in our cycles, you know, year to year, et cetera, on and on, to make sure that we can get that. In a tangible sense, though, that materializes as anything from mental health services, like to help with like substance abuse issues and things like that, to housing. We're plugged in with the HOPWA program, which is housing opportunities for persons with AIDS. And in addition to that, we get funding for our food and transportation and such through the Global Ryan White HIV/AIDS Fund. And that's a contract program, of course, named in honor of Ryan White, very important figure in the history of HIV/AIDS stuff. Won't, you know, go on a tangent, but they're very specific programs, very specific like manners by which we can get those resources to folk. It's not just generalized charitable stuff, but it's very like, this is HOPWA, it's for folk with AIDS. So we can help with like assistance to rent, assistance to utilities. We can get people rides to and from their doctor appointments. And in addition to that, there's even additional stuff that we can provide because of our fundraising that we do, which is like the client Thanksgiving dinners, the holiday dinners, the supplemental gift programs we can do, like Holiday Angels, where we can get gifts to children in the families. So it's kind of, again, like if you just talk to your case manager, then you would be able to be plugged in with any number of those things, from support groups on to, hey, do you need help getting gifts for your children for the holidays?
Right.
Nice, 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 nice. Okay, cool. So we have a comment. We got Dr. Harrison on. She said, my sister was diagnosed in the 90s and lived with it for about 20 years. She didn't die from it. She died from a colonoscopy that went wrong. Wow. Sorry to hear that, Dr. Harrison, but you are basically affirming what we've already stated, that it's not a death sentence. And, you know, being diagnosed with AIDS does not mean that, you know, that there's care available so that you can extend your life. All right, Brittany has joined us. Thank you for being here, Brittany. And then Lady Ward said, I appreciate your work, Joe. One more question. Do you see the stigmas related to HIV being dispelled in 2024? As a long-term survivor, I'm interested as I stand boldly and share my status. Thank you for sharing that, Lady Ward. I appreciate that.
We do see stigma reduced, not as much as we would like. We do see stigma reduced. We have seen a great reduction in our religious communities.
Mm,
I started this work in 2009, and it was difficult to get into a church or any type of religious institution. Now we have reverends, pastors, bishops, ministers, all getting trained to do testing. So that is amazing. Um, we have a lot more information about HIV/AIDS, what it is, the medicines, how the virus, well, how the science around the virus has evolved over the years. So
mhm,
there are broader conversations. I see culture matters. So depending on the environment, the culture that we're in, I do see a reduction. Um, we
mhm,
can be in the same city. On one side of town, we could do 100 tests in this area off of our mobile unit. We can go to the other side of town and we do 20 tests, or we do 2 tests, or we have to switch it up to depending on where we are because of the stigma. So it depends on where we are, the communities that we're in, the cultures that we're dealing with. To answer the question though, yes, there is a reduction in stigma, but not fully across the board, but in specific areas and cultures and communities there is.
Okay, thank you for sharing that. She said, so glad to hear that because the faith based community was not very receptive just a few years ago.
Right.
Yes.
We have
So,
awareness days for that too. That's we just had the National Faith HIV/AIDS and Faith Awareness Day.
mhm. Denise, she said, I'm sorry to hear the faith based community has not been as welcoming. Yeah, I think it's an education piece. I
Mhm.
think there's, like you said, awareness that needs to take place, and some understanding, as it relates to it. So hopefully some of that is what is taking place now with us talking about it this evening. So please definitely, let's keep this conversation going and share with folks in the community that you think will benefit from the education. And Lady Ward said, yes, Nicole, education is a necessity. Yeah, because people have their own thoughts about it without being fully informed. Heck, I
Mhm.
was telling y'all tonight, there are many things that we've talked about that I was not aware of. So I appreciate the enlightenment. So we are coming close to the end of our talk, and y'all have answered all of my questions. So I'm going to give you all the opportunity to give some closing remarks, and then also again share about the walk and how folks can get connected with that. So let's start with you, Serene.
Yeah, thank you so much, of course, for hosting this and springboarding the conversation. We're really happy to continue being able to provide the services we do in this community. And the AIDS Walk is an extension of how we meet that internally to the external sphere of the broader folk that walk along the street and see what's happening. We want to get these two groups more enmeshed. We want there to be a continued public awareness for what's happening with HIV/AIDS in our community, and just a dispelling of any sort of misconceptions or misguidance when it comes to that. Because Again, just because it's not a death sentence doesn't mean that they are not having to live with that and get medical care, et cetera, et cetera. And we need to look out for each other in that community. So we don't want to leave anyone behind, even our the older demographics, like we said. That's also coming up later this month too. Actually, is going to be the HIV and Aging Awareness Day. So come out to the walk, bring a friend, bring some water. It's going to be great temperatures outside and everything. And we'll come and have a good time, get some food in your belly, and hear some great words and carry that with you.
All right, wonderful, wonderful. Thank you for that. All right, Mr. Ward.
All right. So there's a national campaign to end the HIV/AIDS epidemic by 2030, and this is from a lot of the national organizations, the HRSA or the Ryan Wright program. And so what that entails is a collective effort from our community as a whole, not just us who work in public health or who work in HIV/AIDS prevention and care, but from our community as a whole. And that means us doing a great job of making sure we get into the community, giving information, education, resources, access to all of those things, but also us empowering and encouraging our community to join the fight, and you doing your part, not asking anybody to go out and put a cape on and save the world, but just making sure people are able to do their part within their spaces. So referring somebody to information if you can, having safe sex materials available for young people or older people who may need it. Just making sure people know where to go to get tested. Make sure people know where to go to get safe sex materials. Making sure people know about the health centers that exist in this city or within any area that we cover in the Big Bend area. This is a collective effort that will take all of us to make sure that we can help end the epidemic. Also, when I go out and I do HIV testing and I have to tell somebody that they're positive, it's usually somebody that looks like me. And that's not a good feeling to continuously tell people who look like me that they're HIV positive. So I want to encourage parents as well as many adults who are raising young kids, no matter the child's sexual orientation, make sure that you pour into them as much safe sex information as possible to empower them to take care of themselves, reminding them that, and it's a reminder for all of us, our health is our responsibility, but it's a communal impact as well. So making sure that we are not allowing any stigmas or biases to prevent us from giving information to those who need it, especially our vulnerable populations. We want to make sure that we empower each and every member of our community. And like Serene said, September 12th, 6:30 p.m., Southwood Nature Trail, the Tallahassee AIDS Walk. Is going to be fun. DJ Big Boy Swag, he is on the ones and twos. Matthias and I, we are hosting on the microphone. We will have a remembrance. We have a special presentation by Yashika D'Angelo and the health department staff. And so it's going to be great to just come together and see the community as a whole and get some walking in and get a little exercise. So come on out.
Love it, love it, love it. You said a mouthful there, Joe, about the safe sex, the communal impact. All of that is so very, very important. We have a few more comments. Miss Jeanette, who is down in South Florida, thank you for being here. She said, appreciating the work that the team is doing. Ignorance, fear, and denial cause many people in the Black community to not get medical attention. Congratulations. Keep the mission going. Thank you for that encouragement, Miss Jeanette, and for tuning in with us this evening. All right, Denise, very informative. Thanks. We appreciate you, Denise. Miss Ward, she said, really by 2030. Yeah, I was kind of shocked by that too. I wrote that one down. Excellent.
Yes.
Yeah, that's phenomenal. Brother Malcolm, peace and love. Thank you for being here. We appreciate you. Lady Ward said, if you need speakers, I'd like to offer my services and my husband's services. Love it. So is there opportunity for that?
Not at this one, but I got something for them on my mind that I'm gonna be reaching out to them soon.
Okay. All right. So not at the walk, but some other occasion. It's always good to hear from people that have lived experience.
Yes.
So, yes.
Well, they Mr. and Miss Ward actually were speakers for our AIDS walk. I think
Okay.
2019 AIDS walk. So of course they're always welcome to come back, but I got something special for them though.
Okay, all right, Lady Ward. So you just keep your phone ready because he's gonna be calling you. All right. And Alethea has been on with us. Thank you for joining us. So again, I hope you all have found this to be beneficial. This is definitely a conversation that we need to keep going. So please share with your loved ones, with some with co-workers, church members, family members. Look, everybody needs to be talking about this. And yeah, as you said, Joe, that safe sex piece is so important, regardless of whatever your sexual orientation is. We need to stay safe because, as you mentioned, it does have a communal impact. So I see Denise is asking, where do you register for the walk? So it's scrolling across the bottom of the screen, Denise. To register for the AIDS walk at the bigbencares.org by midnight tonight. You can pre-register or in person at the walk. So you are able to register day of, and I'm going to put the flyer up as we get ready to close out at the end. But yes, you can go to bigbencares.org by midnight tonight to pre-register. And it is at 6:30 on Thursday. All right. So great feedback from our viewers. Again, let's keep this conversation going. And y'all keep up the great work. Really, let's keep it up. Let's keep it up. Let's keep it up. For those of you who may be new to the platform, of course, I have to invite you to subscribe to Conversations with Nicole. We're live here on Mondays and Wednesdays at 8:30 p.m. The focus is on mental health and wellness, especially in Black and Brown communities. We will not have a show on Wednesday because I will be hosting an event, but my regular show will be on Friday at 9 a.m. I have Vardis Gaines on, who is a local street artist, and that'll be 9 a.m. on Conversations with Nicole, YouTube, and on Greater Works Network Facebook. So we are about to close out season 13 already. I can't believe it. We got one more show next week with Kia Atkinson. At any rate, we're closing out this hour. I'm gonna put the flyer up. Look, we hope to see you all on Thursday. If you can make it out and support, that would be wonderful. Otherwise, we will see y'all next time.
See you later.
Yes. All right. Let me do my switcheroo here. Hold on. Hold on. Hold on.